Welcome to Rahbar Talk Show. Today we host Dr. Zeynab Aliyari. She is from Department of Applied Cell Sciences. As you know, the application of the stem cells has been extended during the recent decades. And so these cells can pave the way for regeneration of injured tissue. So different aspects related to how this cell can just act and restore the injured tissue should be addressed. Today, please join us and see what happened. Okay, Dr. Aliyari.
Thank you. Hello, dear Dr. Rahbar. Thank you for your invitation. And,
you're welcome.
It's a great chance for me to having this discussion about the stem cells, my favorite field, and
absolutely, it's nice to have you.
Applications in the healthcare and maybe other fields. Let me to have briefly introduce about
Why not?
Stem cells and their characterization, and then we can continue our discussion in application section. As you know, our body composed of maybe more than 200 cells, and each cells have spatial duties and characterization specifications in our body. And for example, osteocytes can produce the bone, or spermatocytes can they have spatial roles in reproduction in our body, and other examples. But what's specific about the stem cells? These cells are unique and a valuable source in our body, and it's related to their specifications and characterizations.
Great.
I can say about their potential in differentiation into different cell types or lineages in our body, and another incredibly valuable specification of the stem cells is their self-renewal ability, which can preserve themselves in the body with this ability. And I don't know, do you have any idea about the...
Okay, that's right. Keep on. We should also just define some of the terms, specific terms, because we have some common audience. They are not familiar with this definition. So
yes,
if it's possible.
And I prefer to speak simply but scientifically about the stem cells until to everybody can use from this information. I mentioned about the potency in stem cells. What is the potency in the stem cells? As I mentioned, stem cells have a potential to differentiate to different cell types. According or based on the potential, we can classify the stem cells in 4 types. Maybe we can find 5 types in some references, but I prefer to classify the stem cells in 4 types. The first type are the totipotent stem cells, which can differentiate to all the type of cells in the body. Or in other way, they can develop to whole embryo and also extra embryonic layers in the body.
Great.
There is just one example for this type of the stem cells, and it's zygote. The cells or egg, a cell that is the result of fertilization in the body. Another type of the stem cells is multipotent stem cells, that the potency of this type is a few less than totipotent, and it can differentiate into a whole embryo, but not extra embryonic layers. And I can give you some examples. For example, embryonic stem cells, which we can obtain these cells from embryo around first week after implantation. And another source or example is induced pluripotent stem cells, which these cells can produce using the differentiation or reprogramming of adult or differentiated cells. The third type of stem cells are pluripotent stem cells, which feel less potency in comparison with totipotent stem cells. These cells can develop to a whole embryo, but without extra embryonic layers. I can give you some examples. For example, embryonic stem cells, which we can obtain these cells from embryo around the first week after implantation.
Right.
Or
as I know, I think that this cell could not just morph the total or entire embryo, because they just lose their extracellular matrix, and there is no any external stimuli to just dictate them to just reshape and morph into the entire embryo. Yeah.
Yes, and the other example that it's a really valuable source in regenerative medicine, which we will speak about that, is induced pluripotent stem cells. These cells can develop from differentiated or adult cells using reprogramming or the differentiation technologies, and these cells also can develop the embryo, but there are some differences between these cells and embryonic stem cells. The third types of stem cells are multipotent stem cells, again with a few less ability in comparison with pluripotent, and also we know these cells as adult stem cells, which can find in some places in our body or some tissues in our body. And these cells are very, very valuable sources in regeneration and replacement of normal tissues during their normal turnover in the body. For example, hematopoietic stem cells in our bone marrow for replacing or renewal of our blood system, and for example, neural stem cells and other examples. And the final types are unipotent stem cells. They are tissue-specific stem cells, and maybe they are more commitment in producing a spatial tissue. But these cells also have plasticity in differentiate to other type of cells, maybe in damaged situation or emergency situation in the body. But in the general, we know these cells as commitment cells, which can produce the adult and specific tissue in the organs.
Okay, as does it concern the boundary? Let me make some brief description about your comments. There are different types of the stem cell, and they can just be categorized into different cell types according to the time and the development stage. Even that they can be just characterized according to their potential to differentiate into the different lineages, as well their cell renewal capacity. So the differentiation is the capacity of these cells to morph into the different cell types, even that they can just acquire different novel phenotype with different functional activities. And even that the cell renewal is a capacity of cell to just preserve their cell resource to produce, different 1,000 types of these cells. Okay, Great. You just mentioned embryonic stem cells and induced pluripotent stem cells. Can you make some difference between these cells types or not?
Yes, a major difference between these cells maybe is their source, and the source which we can obtain these cells from this. And the other difference is the ethical issue related to embryonic stem cells, which it's maybe delete in induced pluripotent stem cells. As you know, we obtain the embryonic stem cells from an embryo, and in somewhere or in some countries there is serious
rigid limitation and restrictions about
strict ethical issues related to this issue, to this source. But induced pluripotent stem cells can obtain easily from our, for example, skin, and we can de-differentiate these cells to stem cells or pluripotent stem cells and use them. But there is a common disadvantage, or how I can say you, challenge about two source, and it's tumorigenesis of the sources after transplantation in the body. And it's the reason that we can't use these cells in the regeneration or in the treat of the disease. And they are useful and valuable sources in the drug screening or disease modeling in out of our body or in vitro. And I think the researchers and scientists try to explore a way to resolve this challenge related to tumorigenicity, but the ethical issues remains as a big challenge about the sources.
Great. As I understood, both cell types, embryonic stem cells and induced pluripotent stem cells, they possess the higher stemness capacity and feature.
Yes.
But the problem is about, I don't know, the source of and how we can just go isolate them. And even that you are right, you are exactly right. Most European countries, even that some other countries have their own restriction and very, very tough laws, and they can just penalize if we could not just reconsider it, and even respect all the ethical issues.
Yes.
And the second one is that the efficacy of the production of the iPSC, I mean, that the induced pluripotent stem cell is less compared to the embryonic stem cells, because the cells, as you mentioned, can just isolate from our natural cell type, and we're going to make some genetic manipulation. We're going to educate the cells to just show some specific behavior, and we are not exactly sure whether the cells can just exhibit our desired behavior or not. So I think the efficacy and the production rate in how can I say, the iPSC is less. Actually, it's illogical.
Especially when we want to use these sources, iPS cells for clinical applications, it's so hard to use viral vectors, integrated viral vectors.
You mean that for production of iPSC, we should just use them?
Yes. In the reprogramming process. And there is regulatory issues to reprogramming these cells.
Sorry, I'm going to interrupt you. Do you think that the application of some non-infectious viral particles is eligible to just produce some cell types, but even that it can make some biohazardous condition,
Yes, exactly. And there is regulatory instructions to use special viral subtypes, viral vectors in the differentiation of the mature cells to produce iPS cells in clinical applications. And also it can affect the tumorigenicity and also other problems in the host body.
But this is the same story for cell type, because these cells, they possess the higher stemness capacity. Even that it is possible, it increases the probability of being tumorigenic, as I understand. But the I don't know, the big challenges is that we could not just omit, eliminate the viral particle from the genetic source of the, manipulated cells. This will be, dangerous in the future maybe. And it maybe, I'm not that sure, because we are at, even that human are at the step of, preliminary steps. They are just conducted some preliminary studies. I'm not that sure even that the iPSC could be just applied directly to the human counterpart or not.
I totally agree with you, and I think it will stay in the field of the drug screening and disease modeling studies.
For what reason they're just going to use embryonic stem cell or iPSC in pharmaceutical industries? Can you make some, example? Why they just...
as I mentioned, this can used in drug screening, for example, in toxicology studies or in testing the drugs, new drugs in a safe environment without using the individuals or animals for test these drugs.
Great.
Yes.
As you know, mesenchymal stem cells are the commonly used stem cell type in human medicine. And as I checked last week, I just found several clinical trials associated with the application of these cells in different human medicine, in the different human diseases, pathology. And these cells just exhibit a reliable platform to just, even elevate and even just reduce some of the pro-inflammatory condition. Well, how do you think that about the, exact role of these cells in human future medicine?
You see, doctor, these cells are favorable sources in medicine or in regenerative medicine in different fields because of their spatial specificities. For example, this cells can differentiate it into different
cell
types, lineages, yes. And the other specificities is their ability in modification or modify of the immune system after inflammation. We can use or apply these cells in some situation, for example, graft versus host disease after bone marrow transplantation. They can improve the inflammation in host body. Or in area of the cosmetic or other inflammatory diseases, for example, arthritis rheumatoid, or they are valuable in the wound healing, valuable source in the wound healing, for example, diabetic or wounds after burning. And they can obtain easily from different tissues in our body or after liposuction surgeries in the cosmetic
purposes.
reasons. Yes.
Yeah. Right.
And I like the cells.
Oh, yeah, great. Actually, yeah, you're right. We're exactly right. These cells are abundant stem cell types, which have been extensively used in human medicine. Even there are several kinds of the clinical trials, which are in their step 1, 2, and 3. And so it is estimated that these cells can be just easily applicable to the clinical setting because of their own properties, and even that you are exactly know that they have their own highly potential regenerative properties. And so even that, as I found in some of the studies, these cells show chromosomal stability. There are it is less possible to just report these cells undergo some genetic aberrancy, and so these are some of the valid cell sources for just manipulate pathological conditions, and even that to restore the function of the injured cell. Even that. As you are right, exactly right. These cells can be just isolated from these different cell types, and but there's one big advantage related to these cells, application of these cells. These cells can also directly transdifferentiate to ectodermal cell lineages and even endodermal cell lineages. These cells are origin from mesodermal layer, but yes, they can just produce some nervous system cells, and even that some of the cells related to the gastrointestinal tract person. Great. Dr. Aliyari, the mesenchymal stem cell can be just isolated from the human own body, even that some other patients and individual, I mean that the healthy individual, we call it little donors. And so we can just, if we monitor all the studies in all different clinics in all parts of the world, we can just find that we have two mesenchymal source, allogenic and autologous. What are exactly stand for? And we can just make some brief description about our audience.
When we want to obtain the cells from other person and use these cells for another person, it will be allograft or allogenic cell sources. Maybe there will be some problems after transplantation. The host cells, the donor cells maybe induce the immune response in the host body, and it will be
problematic.
Yes, and danger for the host. And about the autologous or autologous sources, we can use the patient's own cells for repair or regeneration in the body, and absolutely it will be much better because there is no problems related to immunogenicity. But the challenge related to the autologous is the limitation, limit sources in the body, and also the time-lasting processes in the producing of the specific cells.
When
right. We gathering these cells from the patient's body, manipulate these cells, expansion and re-injection in the body. All these processes are time-consuming, and maybe it
Great. Yeah, you're right. From some aspects, you are exactly right. But as you mentioned, in some, patient, we want to just isolate their own cell for some regenerative purposes. It's actually not possible in some cases and circumstances because, for example, imagine that some of the guys, they undergo some ischemic changes, for example, a stroke or myocardial infarction. The application, their own cells for some regeneration, the injured tissue, actually is not possible. Even that for elderly people, it is not possible to just do uptake and obtain their own cells and just expand it. I mean that the time is gold, and sometimes we should just consider. For that reason, the many clinics and different hospitals in industrial countries and even developing countries prefer to just use the allogenic cell sources. But there's another problem related to the application of the allogenic mesenchymal stem cells is that the possibility of infection transmission. For example, if there should be just some regulatory instruction to just prohibit the probability the transmission of some infectious particle, for example, maybe, and even that your genetic makeup. For example, I'm going to make some touchable example. For example, your genetic makeup is different. Differs from my genetics makeup, and so we should just reconsider how we want to just apply your cell to my body, and even that, and the application of the mismatched sex cells are not actually possible because the immune system can just recognize the cells and just eliminate the cells the few hours after being injected into the body of individuals. Doctor, as you know, in recent years, we just heard some specific terms, precision medicine and precise medicine. What does exactly stand for?
And personalized and precision medicine, a novel approach in healthcare and treatment of the disease. We recently hear these terms a lot, but there is a little bit differences between the precision medicine and personalized medicine. Maybe personalized medicine is the broadly concept of the precision medicine. What's the precision medicine? When we use the genetic makeup of the person, lifestyle and environmental situation of a person or a patient. And we use this information for design a treatment plan for him or her. Actually, we enter in the field of precision medicine. But when we customize more the precision medicine, it will be personalized medicine. What's the example? Imagine a person or a daughter with the family history of the breast cancer in her mother, grandma, I don't know, maternal aunt, and she needs to straight screening for breast cancer, maybe from her 35. And she must go to screenings, and maybe she has some genetic mutations. She have to go for mastectomy, and other examples. But another daughter another daughter, and also she's 35. There is no need for screening for breast cancer. When we used from her lifestyle, from her personal preference in collaboration with her doctors, with her healthcare systems, it will be personalized medicine. When we customize more and more the precision medicine,
thank you.
And we can
Thank
use
you.
it.
Great. According to your comments, I just understood that there's some stem cell types can just behave, for example, one condition inside my body, and it can just behave differently in other bodies. So the genetic makeup, even that some of the environmental factors and the metabolic status can just predetermine how our injected cells can just react inside their bodies. Great. And so I think that for just to obtaining this how can I say, the efficiency in our cell-based therapies, we should just monitor monitor these parameters. I mean, that there's some genetic factors or essential factors could just, predetermine the behavior of cells. I think the future will be just faced with these terms, and we should just also consider in the clinical setting how we want just to treat and recall them for stem cell-based therapies. Yes.
I not totally agree, because we at this time also we use personalized medicine or precision medicine. For example, targeted therapies in the cancer. We detect spatial mutations in the patients and use a spatial treatment plan for the patient. But as I mentioned, because of the time-consuming and cost and being costly, maybe some companies or countries using some treatments which can use for all the patients, not just for one person.
Do you think it is actually possible?
It's not actually possible, but it sounds much better than personalized medicine. The treatments according to personalized medicine are really costly. Imagine an end-stage patient with the cancer. We have to gathering the cells, obtain the cells from this patient, manipulate the cells, and engineering these cells, and then re-inject in the body. And I think it takes more than 2 weeks for an end-stage cancer patient. And maybe here is a place, the healthcare system understand the needs for treatments which can use for more patients, not for all the patients.
It is logical to hypothesize that when we want to just use the one single stem cell type, I mean that's a mesenchymal, maybe other stem cell types, it can just show the different efficacy, different population. I mean
Yes.
that all individuals maybe just respond differently to our medication. So it should be just what I think is screening plans. Pre-screening plans can just inform us about the efficacy of our therapeutic protocols. How do you think about it?
And screening is really important, and especially in the case of cancers, between the diseases, we can give this example. Early detection is very, very important in the treatment of the patient, and here is the role of the screening can be bold for the patients.
Dr. Aliyari, thanks for your presence in this discussion session. I'm gonna just invite you to be just and accept my invitation for the next session, because different aspects related to the stem cell biology should be discussed, related to just preclinical studies and even that to some clinical purposes. I mean, that's some therapies related to the stem cell application. So thanks a lot. Thanks for your valuable comments and information.
I really thank you, dear Dr. Rahbar, for your great discussion and your valuable insights and comments about the stem cells. It will be my honor to have another session with you and catch up again as soon as possible.
Great. Thank you. Thank you. Okay, dear audiences, to support us, please subscribe our channel, like and share the videos. You can also write down the comments below our channels. Thank you. Thank you, Doctor.